In this video of Chapter 8, we will treat the phases of AIDS, the immune response against HIV, the modes of transmission of HIV, and the prevention against infection by HIV. First, let's study the phases of AIDS and the immune response against HIV. The first phase is called the asymptomatic phase and lasts for many years. Basically, the patient doesn't show the signs of infection, but at the beginning of it, the patient shows the signs of a flu infection like runny nose, fever, muscular pain, and fatigue. At the beginning of this phase, the virus was able to infect target cells and multiply. This leads to the increase in the concentration of the virus in the blood. Now, faced to the virus, there is activation of the immune response against it, and this is translated by the appearance of anti-HIV antibodies in the serum. There is an increase in the concentration of these antibodies in the serum. In this case, the patient can be qualified as seropositive, which means that he or she has anti-HIV antibodies and he or she can transmit the virus to other individuals. The produced antibodies contribute to the decrease of the concentration of the virus in the blood. The latter tries always to replicate, but the hyperactive immune response blocks these trials without eliminating totally the virus. So, in the remaining time of the asymptomatic phase, the concentration of the virus is almost constant. What about the T4 lymphocytes? The virus kills the T4 lymphocytes, and the immune system tries to replace them by other new ones. But when it loses this capacity, the number of T4 lymphocytes start to decrease. But during the asymptomatic phase, there are enough T4 lymphocytes to induce an effective immune response against the virus. Now, the second phase is the phase of slight immunodeficiency, during which there is an important loss of T4 lymphocytes, which leads to the decrease of secretion of IL-4. This is translated into a decrease in the release of anti-HIV antibodies, so their concentration decreases. As a consequence, the virus can replicate easily, and its concentration starts to increase. Infectious diseases start to be frequent. The third phase is the phase of AIDS. As you see, the number of T4 lymphocytes becomes almost null. The immune response disappears. The patient develops an increasing number of opportunistic infections by microorganisms that are normally benign for healthy individuals. Also, cancer may develop, and this phase ends by the death of the patient. Now, concerning the modes of transmission of HIV. HIV can be transmitted from an individual to another through an unprotected sexual contact or from an infected pregnant woman to her fetus or from a breastfeeding woman to her newborn by breastfeeding uh, or due to contact with a contaminated blood, especially in drug addicts that share needles, or during the transfusion of a contaminated blood, or during organ transplantation. Now, certain activities like shaving, tattooing, ear piercing, or dental care. As you see, these activities involve the use of needles that can be in contact with blood. If good precautions are taken, there is no risk of transmission of HIV. Now, concerning the prevention of infection by HIV, we should say first, there is no definite cure for AIDS. The adopted treatments only slow down the evolution of the disease. And the prevention of infection by HIV and all agents of sexually transmitted diseases is done by the use of condoms.